Amanda, when you initially came in, of course you had a lot of pull in the groin, so you twice a week. For 6 weeks, focusing on balancing out the round ligament, the uterus, using what's called the Webster Technique. How have you been doing so far?
Much better.
Okay. You know, for those that don't understand or know what Webster Technique, so a lot of women during pregnancy will get imbalancing in the uterus. Basically, uterus is supported by two ligaments, the uterosacral ligaments from the back and then the round ligaments in the front. What happens is through either rotation in the sacrum or the pelvis, there could be imbalance in those ligaments, pulling and twisting the uterus, cause a lot of discomfort in women. So we're going to do check Amanda's entire spine out, but really making sure we focus on balancing that pelvis out. So, okay. Let's have you lay in your stomach for me. Is that comfortable?
Yep.
Okay. So the first thing I'm going to do is check your sacrum out. The easiest way of doing that is just bringing both heels up towards your buttocks. Okay. Can you feel the difference here? Feel how much easier this one goes up than this side?
Oh yeah.
Yeah. So definitely some rotation right here in your sacrum. And of course, as you're aware, there's different ways we can adjust you. I'm going to adjust you laying with the drop stick, okay? So you're going to feel this table come up from underneath you. I'll set the tension just like that, okay? So what happens when that sacrum twists, it's going to pull on that round ligament up front. I want to make sure I balance that sacrum out. Let's just recheck that. Can you feel the difference there? Yeah,
Absolutely.
Much better. Great. We're just going to check everything else. I'll actually drop this down. There you go. Our bodies works as a whole, and your body's working twice as hard right now because it's not just supporting you, but it's supporting your little one in there. Okay, and then you can take a deep breath in for me, please. Nice, need low pressure, quick motion. Thank you. Good job. Awesome. Okay, now let's have you go right on your back for me. So now we're going to work on that round ligament, okay? And of course we've done this before, but just so I can show the camera. So we find our belly button. I usually just like that ask her where her belly button is. Now this is right where that round ligament is, so I'm just going to apply pressure. You can feel that, can't you?
So much better though than before.
Yeah.
You have to breathe through it.
So it's so awesome too because when that round ligament relaxes, we'll actually be able to feel the baby move. It just allows that uterus to open up. There you go. Awesome. Okay, good. Let me just make sure that balance everything out here. Okay, let me get your neck checked, okay? Awesome. All right, good. Let me help you out. That was great. So definitely needed that Webster Technique just to help balance it out. I mean, right now, you're on that last stages, you know, it's kind of like almost ready. You know, just keeping everything balanced, going to help with the labor, it's going to help a lot keep things easier. So good. Thank you. I appreciate it.